Welcome back to the Only Healthcare Podcast. I'm Randy Vogenberg here with my co-host, Michael Navin. And this is our year-end episode, thanking all our listeners for participating and listening over the past year to our podcasts on healthcare and all the different aspects that we've seen occur and will continue to be occurring as we go into the new year. We appreciate and have much gratitude for your listening and continuing to follow us through the Only Healthcare Podcast. Today, what we're going to do is a review what we think are our top issues that came up during the year and our thoughts as we begin to change our perspective to look at 2026. So, Michael, why don't you start off with a couple of your hot topics from 25?
Sure. Obviously, I think this year we saw towards the end of the year a real stalemate with the government shutdown around healthcare and the impact that has, and really the diabolical deposed or opposed thoughts about healthcare and how it should be reimbursed and paid for and supplemented. But really to start the year, I think, and to start on a positive side, I think that we're seeing the transformation in consumer-driven healthcare. And we're seeing that through a multitude of things around, CMS laws and Consolidated Appropriations Act, that price transparency of all services are required and are paramount to helping people understand what things cost. And that has two things, right? It has a positive implication, which is, some people don't seek care because they think it's not affordable. But when you see what things actually do cost, you might say, well, that is pretty affordable, right? So maybe that encourages more people to actually seek care that they need versus wait for something bad to happen, right? Creating better outcomes in the system. So I think when you look at those trends, when you look at the fact that the biggest controversy continues to be the GLP-1s in terms of the expense and the utilization of those products, and really the affordability of those products, and the manufacturers, to their credit, have recognized those challenges and have come up with some pricing strategies that we've recently seen around direct-to-patient pricing. You hear about it, and now you're seeing the changes, and the changes are happening. So I think in a lot of times in the times we've spent in healthcare, they've talked about change, but change never really took place. So I think what we're starting to see is actual change for the better. There's still the challenge of, all the different fingers in the pot, if you will, in terms of people getting paid off of healthcare that want to continue to be paid off of healthcare. And so as that evolves and that changes, you'll see in my opinion, you'll see industries blossom and you'll see industries fail, only because it's an unsustainable model, right? So as things change, as we see these changes, and hopefully patients become more educated using these resources to their advantage, that there will be more of a demand for change by more than just this industry, but by the patients and lobbying groups and things of that nature. So yeah, I think a transformational year into next year. Obviously, Trump making his announcement around Trump RX, which, for my opinion, is a lot of noise, but his concept is where the market seems to be going. So that's a good thing. So yeah, I think lots of changes happening, and he's going to be president for 3 more years. So I think it's like buckle in and go for the ride and see what happens.
Yeah, well, certainly the beginning of the year, we had a continuation of what started right after the election in 2024. Legislation, initiatives, the executive orders that were streaming out of the White House, which really served to shake up the pricing matrix, as well as driving some of that cost transparency that you were talking about across all the manufacturers and the ecosystem within healthcare. We're seeing the same thing evolving more so in 25 around the health plans and hospitals as part of that populist consumerism movement, which I agree with you is going to be driving a lot more change as we look forward. The second thing is something that had been talked about for a long time. It hadn't really happened, but then all of a sudden we saw some activity in 24 and then throughout 2025 around various litigation and lawsuits that were affecting the commercial ERISA plans that the employers utilize. It's also affecting the health plans. It's affecting the manufacturers around their rebates and discounts. And this whole area of how do you begin to address the pricing and the affordability of healthcare on the medical benefit side, as well as with drugs on the pharmacy benefit side, which are serving to extend that consumerism through litigation efforts. And then the third area, which is
can I interrupt you on that one real quick though?
Sure, yeah, go ahead.
But none of those lawsuits, nobody won those lawsuits, right?
It's not win or lose. There were lawsuits. We never had these kind of lawsuits before.
So you're saying they're paying more attention regardless.
They're paying more attention, and eventually, as what typically happens with lawsuits is you have some lawsuits, you win, you lose. We see the same thing going on with Trump in the Supreme Court. But you're trying to define what are the edges of the decision making that goes on. In this case, with healthcare. So yeah, a couple suits didn't make it, but now they're going to be litigated further, either on appeal or there'll be follow-up lawsuits that'll be more defined. And we're beginning to understand, well, what can you really start looking to change more specifically around these health plans, which we didn't have before, and nobody was willing to litigate before, but now they are willing to litigate. So this whole movement that you were talking about earlier around change is in full force, and it includes this litigation aspect, which we hadn't had before. It was always the possibility, but now it's happened. Kind of a similar vein, not so much on litigation, but just what are some of the other shifts that happened? And one of the things that we saw really evolve in 25 has been employee loyalty shifts, causing change in value and outcome determinations, particularly in the healthcare space, along with expectations for healthcare that has caused some limited disruption right now, but there's a lot of potential for more disruption as we start looking forward, as employers begin to react to this issue around employee loyalty. Will these employees that I'm able to attract to join my business or keeping them in my business, will I be able to sustain that? Will I be able to continue to hire or retain employees going forward based around my healthcare benefits? And that has become an increased area of concern for both sides, both employers and employees, and all those that are covered by employer benefits. So the spouses of the employees are also in play. And we're going to see that emerge as probably more of an issue when we start talking about 2026 as well. And that's something we hadn't seen overtly, again, similar to the lawsuit thing. We're now seeing it very overt in a lot of industries around this issue of loyalty for recruiting or retaining employees that you want to have in your workforce. So those are the three that kind of pop out in my mind that will affect healthcare, health plan coverage, which gets into the affordability conversation that has already started in 25 as well.
And do you think this, from the numbers, it seems pretty significant, but has there been a bigger shift from fully insured to self-insured? Is that?
Yeah, it had been a growing trend. It kind of stalled during the pandemic. It kind of restarted again. And in 24, 25, and what we're seeing in 26 is a continued increase in self-funding by employers. So the federal ERISA law comes into play a lot more. So those early lawsuits that we talked about before become more important because you're trying to understand what are the legal limitations and requirements that I have as a plan sponsor if I go into self-insured. And then also, how does that affect how I deal with this loyalty problem that is becoming more manifest in the marketplace? So when we look at 26, I'll start on 26 and then flip it over to you. What are some of the strategic trends that I'm seeing around employer health and well-being plans? Is that we're going to see, as I mentioned before, a more refined and expanded number of lawsuits coming on the ERISA side, which is the self-funded employer plans, as well as the commercial insurance plans, the Aetna, United, Cigna, et cetera. And that's going to affect hospitals as well, both directly and indirectly, because that's where we get a lot of our care, particularly the advanced care. And the cost transparency that goes along with all of this. The hospital transparency, which still remains an issue. The health plan transparency in terms of the administration of the plan, as well as the cost of the therapies or the cost of services that the health plan is reimbursing. So this is going to add to some of the disruption that we've already seen happen in 2025 as we go through 2026 and even into 27. So we got a couple years of very rocky times just looking at what these health plans are going to look like. And that may cause the second area, which is more shifting into the consumer access area and affordability, but not as well defined in terms of as a plan sponsor, whether I'm an employer or an insurance plan through a commercial insured organization. What are the outcomes? What am I trying to get out of this? And that kind of leads into what we're beginning to hear more and more is the concept of either paying cash in healthcare or looking at other ways in which you put money in the consumer's hands, let them make the decisions, let them make the choices, and thereby they're determining what outcomes they're looking for. So the health savings accounts, the medical savings accounts, the health retirement accounts, all those there's some opportunity to use some of that money for health services and well-being are going to come up. So that's going to affect the early rate planning that's going to happen in early 2026 for the 2027 plan years. And then finally, what we're going to see as a result of that big, beautiful bill that was passed in 2024 by Congress is the economic impacts that will fall out from that that's going to affect employer and commercial plans, particularly along with those loyalty shifts I was talking about among the younger working population. And that may cause further or more modest coverage changes depending on the industry and the area of the country for 2027. But overall, it kind of underscores the importance that there is a desire for change that's going to continue in the marketplace that we see in 25, in 26, and will continue into 27.
Yep. Yeah, and I think there's a couple things I would think of. I think just on the economic front, it sounds like 26 will be a fairly solid year. Job market will probably remain pretty stable. But I think in 2027, 100% of the baby boomers are now into Medicare. So I think you're going to have this drain on Medicare. Not trying to be negative, but it's a bankrupt system that's going to get more bankrupt, right? And how do you bring those two together without saying, well, there's no more money left for anybody over 65, right? That's the challenge because that's the biggest drain on the system. The biggest utilization of healthcare is in that population. Mm-hmm. And if you don't have the money to fund it, because even the younger generation isn't necessarily funding it through their payroll for the second generation, the third generation, then where's that money coming from? So
that's a great point.
We talked about it on our call with Jason, but do you have a situation now where that becomes almost a single payer? Is that an impetus for a single payer? Where it's more socialized medicine, because it's got to run downhill, right? And it's also got to run uphill. That's a concern I have, in the trends that are happening. And then the other part about the economy piece is, what if there is a negative downturn in the economy, right? Where now there's a high level of unemployment. How are those people going to access care, if they don't have a benefit? Mm-hmm. So that becomes another challenge, because then do they have the resources they need to be able to access care while they're unemployed, and either do or don't have the cash or the capital to fund their own care. So those are the things that I kind of think about as challenges moving forward.
Yeah, I think on a positive note, what we're hearing is more positive economic news. The stock market's done well in 25, expected to look good in 26. The trillions of dollars being invested bode well for a robust rebound in first and second quarter of 26. Hopefully that all pans out. Would be great, I think. But it doesn't necessarily solve the questions that we have and what you're bringing up in terms of some of the concerns, should that not be fully realized. We only get a partial realization of some of that upscale but opportunity that's coming into the United States.
Yeah.
But as always in healthcare, there's always something new around the corner, and that's what we're going to be looking at in 2026 through the Only Healthcare podcast. We appreciate our listeners, and we welcome your feedback and input on future topics and areas of interest that you'd like to see us cover, either ourselves in these conversations or with our guests as well that cover different aspects of the United States healthcare system. Have a happy and healthy new year and a great 2026.
Thank you for tuning in to the Only Healthcare podcast. We hope you found today's episode insightful and informative. Remember, our mission is to provide actionable and inspirational insights on how we can improve healthcare cost, care, and accessibility for all. If you enjoyed this episode, please subscribe, rate, and share with your friends and family. For more resources and updates, visit us at onlyhealthcarepodcast.com. We'd love to hear from you. Let us know what topics you'd like us to discuss in future episodes. Until next time, stay informed, and together, let's navigate the journey to better healthcare.